Aurora Healthcare Geriatrics Fellowship Program is part of a big healthcare system where we have 14 hospitals in Wisconsin. However, you feel part of a close-knit family. You have a unique clinical experience, a rigorous didactic curriculum, and a passionate, dedicated faculty working with the interdisciplinary team that is very used to having fellows in an academic setting.
I will say I absolutely love being a geriatrics fellow. I think the environment that we have here is second to none. If I were to pick out one thing that I really love about this program, it's the people. The faculty are very passionate about care of older adults. They love to teach. You'll have a lot of opportunities for academic and scholarly endeavors, and they're very approachable too. I'd say one of the things that I always tell people, one of the reasons that we've gone from being at Sinai, a small community hospital, to a leader in geriatric care is because of having that strong leadership.
In our clinic setting, we have a strong primary care practice, and the patients have been coming to our clinic for generations. For example, I took care of a family whose grandparents have been coming to our clinic. The inpatient service is between two hospitals. The benefit is that the patient population in both the hospitals is different. So one location is Sinai, which is in the Milwaukee City area. We have the oldest and the first acute care for elder or ACE unit at Sinai. So the fellows are able to work with the interdisciplinary team, with a social worker, nurses, and learn firsthand how a ACE unit works. At St. Luke's, they're able to work with a tertiary care center where patients are referred from all over the state. And they provide consultative services with the geriatrics faculty on very sick, high acuity patients. Geriatrics Difficult Case Conference, which is a national level case conference across the nation. The fellows have experience of working with faculty from different healthcare systems and fellows across America. It's a very good experience both in geriatrics medicine and behavioral health skills.
I think you get a lot more education and training in how to really deliver care for marginalized populations in ways that you wouldn't be able to otherwise. You get a lot more training with how to use an interpreter and how to effectively communicate to patients. You get a lot more training in cultural sensitivity and understanding how social determinants of health really impact your patient population. Having opportunities to do home visits here in Milwaukee has actually really opened my eyes to things that I wouldn't have in a simple clinic visit. To actually go into people's neighborhoods and have a better understanding of what it's like to not be able to go out onto your front porch, for example, because you're worried about gun violence, or you have food insecurity, you're not able to stock your pantry. Those are very humbling experiences that I think are unique to the program here.
I would also like to talk and highlight our Project ECHO memory loss case conference, where the fellows are able to work with neurologists from our healthcare system and present their patients who have memory loss, get feedback from the neurologist and geriatricians in a very academic setting.
I would say almost anyone can thrive in this program. I think one of the things I like about it is I am probably happier now than I have been the last 7 to 10 years maybe. One, because the work that I'm doing is so meaningful, and two, because I feel like I'm actually contributing something to patient care and that I'm not just there to write notes or see as many patients as possible. You get a lot more time with patient visits in geriatrics because the patients we see are older, they're more complex, there's a lot more issues that we're addressing, so you have a lot more time to go into a detailed history and really formulate an individualized plan for that particular patient.
The fellows will always feel comfortable with their peers, colleagues, and we have a very passionate faculty, nursing staff, and social workers. So when they're leaving the program, they feel like they've been part of a close-knit community. We have a bright future ahead. The reason I feel that way is that we are part of a healthcare system where things are always evolving. There's a culture of quality improvement, practice improvement, and fellows are able to learn from that environment and grow in that environment.